Hello, and welcome to day 2 of the Hunger Free Community Summit. We are starting today with a panel on debriefing the White House Conference on Hunger, Nutrition, and Health. I'm Minerva Delgado, Director of Coalitions and Advocacy at the Alliance to End Hunger, and I'm thrilled we've put together a great group of panelists for you. They are Anwar Khan, Islamic Relief USA, Casey Aden-Wansbury, Instacart, Diane Sullivan, Equitable Spaces, and Dottie Rosenbaum, Center on Budget and Policy Priorities. Please read their bios on the platform. So, to provide a little context before our discussion, over 50 years ago, the first White House Conference on Food, Nutrition, and Health resulted in more than 1,800 policy recommendations to reduce hunger and promote nutrition and health. In 1969, the conference led to an expansion of SNAP and the school lunch program, as well as the establishment of WIC. The conference at the time created meaningful and necessary conversations to address hunger and food insecurity in America. Therefore, it was important for the anti-hunger community to support calls for a new White House conference. In 2021, we worked with Chairman Jim McGovern's office to promote legislation co-sponsored by the late Congresswoman Walorski, Senators Booker and Braun, directing the White House to convene a conference on hunger and nutrition. And for almost a year, the Alliance, our partners, and I'm sure all of you advocated that the White House publicly commit to hosting a conference and that there be a significant focus on ending hunger as a key strategy. There was a tremendous effort from our community, coalition meetings, sign-on letters, recommendations to the White House, and national anti-hunger groups came together and submitted joint recommendations, which I include as a handout here, that the conference must be centered on addressing poverty-related hunger and its root causes, engage people with lived experience and expertise in hunger and poverty and nutrition program participation in meaningful ways, that the conference build and leverage political will by convening cross-sector stakeholders and focus on reducing racial, ethnic, and other disparities in food insecurity. Once the White House announced that they would hold a conference, they rolled out a significant outreach and engagement strategy, which included listening sessions and story collection. Once again, the anti-hunger community mobilized to hold listening sessions and submit recommendations. The White House convened an interagency task force to review recommendations and create a national strategy, which was released at the conference. That's also in your handouts. It was exciting to hear President Biden open the conference and say, I know we can do this. End hunger in this country by 2030 and lower the toll that diet-related diseases take on too many Americans. With that background, let's bring our panelists into the discussion who will respond to a series of questions, and then we'll open it up for audience questions. So welcome to our panelists. And I'll ask all of our panelists to make sure that they're on camera and not muted. And so let's start with, what was the highlight of the conference for you, either in person or virtually? And let's start with the two folks that were there in person. So Anwar, why don't we start with you? What was the highlight of the conference experience for you?
Thank you, Minerva. Good morning. It's wonderful to be with amazing panelists. The thing that really affected me was that there was a session where we had people with lived experiences, people from communities. So we had the professionals who actually experienced it, and we had farmers. So usually when I think of hunger, I'm thinking of the people that we're providing support directly to. I'm not always thinking the farmers and their issue. So some of these farmers are growing food and are themselves hungry. Other people were explaining how they were living out of their cars and with their families. And it just reminded me of some community I grew up with. And out of the 6 people, 2 of them were crying during the session. And there was empathy. So to me, that particular, because we heard so much about numbers, we heard about policy, but we didn't hear about the human cost of when we fail, and also the human spirit when we succeed. And I was able to make connections with a rancher from upstate New York who provides halal meat to Muslims during the time of the celebration of Eid. And she was explaining how she enjoyed doing that. So it's wonderful. I would not normally be able to talk to somebody like that. So it really helped to increase and realize that we're part of a community, and we should get out of us, really reach out.
Thank you, Anwar. I feel like I was there based on your description. Thank you so much. Diane, why don't we go over to you?
Yes, thank you, Minerva, and good morning and good afternoon, everyone. It's so great to be here with you all. And I would have to say, without a doubt, that the highlight for me of the conference, and honestly of my career, was watching my co-founder of Equitable Spaces, Jamika Mills, step onto that main stage and introduce President Biden. That remains such a remarkable moment for everything that it represents. And I think, very much to Anwar's point, and as you mentioned, Minerva, there was such an incredible effort by so many of us here in the room to ensure that people with lived experience in hunger were represented that day. And it feels to me that what Jamika was able to do with such sincerity, with such poise and such grace, she really demonstrated. And really, all those folks that you're speaking about, Anwar, all of those with lived experience throughout the event really demonstrated and affirmed me that, I belonged there, that we all belonged there. And so, as someone with lived experience who's been advocating both, personally on behalf of my own family and systemically, and at all levels of government for 30 years, my view on this movement to meaningfully engage community members with lived experience is pretty long. Like 30 years is a long time to be doing this. And so what that moment, that type of representation, it was just incredibly affirming. And I will add this to another highlight that actually came early the morning after the conference, when those of us with lived experience were invited to tour the White House. As a group of us were exiting the tour in this, giant marble-filled room. So imagine the acoustics, and standing before President Obama's White House portrait, Tanisha Harrell, and shout out to T out in California, she asked permission of a Secret Service agent to sing. And as I walked toward the door, listening to her sing a few lines from His Eye is on the Sparrow, that too was another affirming moment that for me, I was right where I belonged and right in the right place at the right time. So thank you.
Thank you for sharing those beautiful moments. Not all of us were as lucky as you both to be there in person. So I'd love to get perspectives from our other panelists who watched it via video like I did. Dottie, why don't we go to you?
Great, thank you. And thanks so much for inviting me to join today. And hello, everybody. So as Minerva said, I participated virtually, but our Vice President of Food Assistance, Ty Jones-Cox, was in the room. So I discussed this question and actually all of the others with her as well. And we both agreed that the main highlight was, just as Diane said, sort of watching our president talk about hunger and the challenges that people face. And also having Jamika Mills introduce President Biden was chill-inducing, right? Like it was quite striking. And knowing that there were all the people with lived experience in the room and that people went, to great lengths to make that happen felt really important and really meaningful. Ty tells me that there was the strongest feeling or energy in the room when people were talking about the hunger and poverty reduction aspects of the meeting, that there were standing ovations for the impacts of the child tax credit as a policy and protecting SNAP and universal school meals. So it felt like what we had worked for from a policy standpoint, in terms of making sure that anti-hunger issues were being heard and were not overlooked, was largely successful. And that was really rewarding for us to experience.
Thank you so much, Dottie. Casey, over to you.
Yeah, thank you. And thank you to the Alliance for organizing this conversation and inviting me and Instacart to be part of it. A little bit, I don't know how many of you are familiar with Instacart, but I'll just give a little brief explanation for since I think we're kind of a newer player to the policy, to the hunger and food advocacy world. We're the leading grocery technology company in North America. Our mission is actually to create a world where everyone has access to the food they love and more time to enjoy it. So this work is very important to us. And the way our business works is we partner with about 9 retailers to deliver from over 75,000 stores across the US and Canada. So in total, we reach about 90% of households in North America. And you know, for us, it's a real pleasure to be able to be part of this conversation. We were proud to be able to participate in the conference. My CEO attended the conference in person, and we were able to announce a series of commitments, which I know we'll get into later. But for us, really, the highlight of the conference, in addition to what other panelists have said, I think the lived experience was really, really moving and important to really, you know, bring focus. But I think for us also, I would say it's just the sheer breadth of perspective and background of the participants coming together, both in the room, in the commitments listed, in the lead up to the conference, was really impressive. Stunning. I mean, these are just such complex systemic issues, and I think we left the conference really feeling that you know, feeling the close collaboration that's going to be required from, you know, across public sector, private sector, nonprofits, research, academia, just being able to have all of those folks together focused on this issue. On these issues for a full day was really powerful. So we were just proud to be part of it, and you know, proud to help continue this conversation after the conference.
Thank you so much, Casey. Casey, why don't you keep for as we go to our next question, which is, how has your organization, in this case business, engaged with the conference, either before, during, or, you know, continuing?
So we started our engagement before the conference in the lead up. Many will remember, of course, that the White House put out a call to you know, the public and private sector to bring listenings to host. So Instacart partnered with a number of community organizations around the country. I think we did, we did Miami, Atlanta, New York, Chicago, Portland, Oregon. We hosted listening sessions with community partners that brought together elected officials, community leaders, and experience in food insecurity, to really focus on different topics and sort of think about what we could bring to the conference leading up to it. So some of the common themes emerged are those I'm sure many are familiar with who have been doing this work for a long time. We ended up talking a lot about the importance of public-private partnerships and bringing resources from a number of sectors to bear. We talked a lot about you know, different sets of acute needs that are facing different underserved communities, and you know, treating individually. And we also talked a lot about better nutrition education and the real need in a lot of communities for more access to more information. So we worked through all of that and brought that to the White House to help inform their agenda and the commitments that they put forth. And then at the conference itself, we were proud to announce several new commitments. We actually launched a major new initiative, Instacart Health, that really ramps up our work through all of this area. And it includes a series of product innovations, partnerships with third parties, research, and then expanded policy advocacy. So, you know, we've seen that online grocery delivery helps people get access to fresh food and help healthier eating habits, helps them save time, helps them manage budgets, eliminate transportation barriers. So a lot of potential there. And we really believe we have an opportunity and a responsibility to help be part of that. I can talk a little bit more, you know, going forward about the details of our Instacart Health. Really, it's focused around 3 goals: nutrition security, making health and healthy choices easier, and then incentivizing food as medicine programs. So we're proud to make a number of commitments related to that at the White House, including a partnership with the Partnership for Healthy America to bring 10 million servings of fresh food and vegetables to families across the country over the next 3 years.
Wonderful. Thank you so much. Why don't we go to Dottie next with that question? How is your organization engaged with the conference?
Thanks. So When the conference was first announced, we worked with many of the major national anti-hunger organizations to pull together the principles for the conference that Minerva mentioned at the start of this session, that were aimed at centering the priority of addressing poverty-related hunger and its root causes. Our goal was, given that the 5 pillars that the administration had laid out were sort of parallel, to try to keep the focus as much as possible on hunger, on poverty-related hunger, and having a comprehensive approach to addressing the problems associated with poverty-related hunger. So we strategized with our partners at the national level and in state advocacy groups around these priorities. We supported them in participating in listening sessions, in leading listening sessions, and in submitting written comments on the strategy. And of course, we wrote comments of our own, and many of our recommendations are included in the strategy, which we'll discuss in a minute. And finally, on the commitments, the goals of the conference and the strategy, the contents of the strategy are the goals and the strategy of the Center on Budget and Policy Priorities, where I work. We are, and that we have been focused on since our inception. So we are strongly committed to continuing to work on these issues. And of course, not just anti-hunger, but on the full suite of anti-poverty measures as well.
Thank you so much, Dottie. Anwar, let's go to you. How has Islamic Relief USA been engaged in the conference?
My colleagues from public health were involved in they were involved a couple of months before the conference. We were also involved with the line, the sponsor reception the night before the summit. We brought together Jim McGovern, but Muslim, Jewish, Christian, and other religious. We wanted to make sure that there was a safe voice at the summit. It's very important to remember that most of the work is done by local partners. Many of these local partners are different. So we wanted to make sure that that was also we're also concerned about some diet, whether that be for faith, that this was included when we were looking at accessibility issues. And we made a commitment, Minerva, to make a commitment. So that was the commitment we made, because to us, this is the work we've been doing for decades. And now what we want to do, we want to be able to put it on. We are involved in anti-hunger, anti-poverty around the world, but also here in America. So this helps to give us added to add our voice, other voices. We work mostly through a network of hundreds of local partners. Find a better way of showing the metrics of how we're able to get to populations that are normally overlooked, meals we're providing, and so on. We'll be working on that.
Thank you so much. Diane, over to you.
Thank you, Minerva. So like my view on the movement to engage directly with those most impacted in more meaningful ways, my view on this conference is also pretty long. I've had the good fortune to have maintained a great relationship with Chairman McGovern. We all know in this room, he was a champion in making this conference a reality. And of course, he and his staff. And so we met with his staff specifically around the conference back in the spring of 2021. And as it was announced that last fall that funding for the conference was appropriated, like many others here, we shared a list of recommendations specific not to any particular policy, but rather focused on how conference organizers might go about engaging community members with lived experience. Specifically, both Jamika and I were invited to share at our respective regional listening sessions, Jamika in the South and myself in the Northeast region. Like Dottie and Casey's noted, we also participated in other listening sessions and hosted one for community members with lived experience with some of our partners here in Massachusetts. Like many of you, we attended the bi-weekly stakeholder calls. And while Jamika and I were in DC on business this past summer, we reached out. We were fortunate enough to secure a meeting with conference organizers. And we are really honored to be working with the White House as they connect directly to individuals with lived experience, not only around the conference and what happened that day, but ways to really better understand and connect folks with lived experience to the national strategy. For those that know, equitable space is of most importance to us, and really core to our mission is that community members with lived experience are not just invited into the room, but they are properly informed and supported throughout the process. And as I noted this, but in 3 decades of doing this work, this type of engagement on this level of government is really unprecedented. But it doesn't come without its challenges, of course, just like in these spaces here in the anti-hunger community. So I'm really grateful to the openness and the care with which the White House staff has engaged and continues to engage. I'll talk a little bit about that in a moment. But they're really continuing to engage with community members that are most impacted.
Wonderful. Thank you so much, Diane, for that. Okay, Diane, why don't you keep the floor? We're going to move to our next question, which is, they put out this national strategy, which is pretty hefty. And in looking at what's in the national strategy, and just a reminder to our attendees that there's a link to the strategy included in the session. What specific recommendations are you or your organization pleased with in the strategy?
Yeah, thanks, Minerva. Of course, just to highlight a few, right? We've these efforts to streamline SNAP and WIC enrollment and to close the Medicaid gap, increased access to free school meals and summer EBT, expanding SNAP and WIC online purchases by adding more online retailers and hopefully providing them the supports that they need to participate. Increased funding for the Older Americans Act, the nutrition programs, of course, investing in EITC, child care, Section 8, and more, and certainly, removing the SNAP felony ban. I'm going to just note there's so much to be pleased with here. And I'll also take a moment here to share about something that I was pleased to not see in the strategy. And what we didn't see was a recommendation to restrict SNAP purchases. So I want to give a shout out to all of those who advocated that was not the right move for us to make. However, what the strategy, does, it calls for an expansion of incentives for the purchase of fruits and veggies in SNAP. We have this program going here in Massachusetts. We call it the Healthy Incentives Program, and it works. So, I was pleased to see that rather than disincentivizing or punishing people for purchasing food deemed to be unhealthy, really these type of investments and incentives is really the approach that we need, one that actually gets at the issues of access and affordability, all while supporting local farmers. So it's, so very pleased to see those things come out of the strategy.
Thank you, Diane. Why don't we move to Dottie with this question? What recommendations were you or your organization pleased with in the report?
Yeah, I think I'm going to echo a lot of what Diane said. The strategy does reflect many of the things we included in our comments and that the anti-hunger community broadly supports, including things that address poverty more broadly through fully refundable and expanded child tax credit and which address. Sorry, is there feedback?
No, you're fine.
I'm fine. Okay, sorry. So the importance of having cash assistance for people to actually have income with which to buy food, but also to meet their other needs. Also, high quality childcare, expanded housing assistance, closing the Medicaid coverage gap, et cetera. And then the specific changes that were recommended within the food assistance programs, such as expanded SNAP access for adults who are subject sometimes to a 3-month time limit, expanded bringing the territories into SNAP instead of having them participate in a block grant, the end of the helping formerly incarcerated individuals who were subject to the felony drug ban, and college students, as well as summer EBT. So a whole host of things within food assistance and outside. And the one thing I'll measure is that most of the things I just talked about require legislation, but the administration also committed to many improvements and activities that don't require legislation. For example, working to make sure that people who are eligible for and enrolled in one program are also receiving other benefits that they qualify for. Partnering, having federal agencies do a better job of partnering with one another, expanding screening for food insecurity across federal healthcare systems, and calling on states to achieve 95% of cross-enrollment across Medicaid and SNAP, and then processing eligibility for SNAP within 1 week. So this, among many other things that they sort of signed themselves up for, are really important. And finally, I was very pleased to see committed to measuring equity within the food assistance programs. I think that's really important. And as we move forward, all of these things that don't require legislation, it's important to make sure that they actually do them.
Thank you so much. Casey, let's go to you next with that question. What recommendations were you pleased with?
Sure. We were actually pretty pleased with the full list of pillars. The really all key pillars line up pretty well with Instacart Health and with our own policy agenda. So we were pleased first off with that. But I think to echo some of what Dottie and Diane have said, the section on food access and affordability really resonated with us. We have been involved in the online SNAP program since the beginning. We actually helped pioneer the retailer onboarding process that folks have mentioned before. And actually now more than half of EBT SNAP retailers secured their accreditation through a partnership with Instacart. And so we feel excited about what we've been able to do there, but there's so much potential. Our own commitment going forward is that we plan to expand. Right now we have about 70 retailers, expanding more than 8,000 stores. We cover 49 states and DC, so we're almost to 50 states. We'll hit 50 states in terms of SNAP coverage online next year. And then by 2030, we've committed to having all of our 900 grocery retail partners on SNAP. So we're really pushing that on our own, but working closely with FNS and with all of our retail partners. But we think that same concept of bringing programs online, there's so much more we can do there. We really appreciated the focus on bringing TANF online. We're going to be able to do EBT TANF in 2023 as well. We're on track to be able to unlock that as a form of payment on our site. And then longer term, we were encouraged to see the idea of bringing WIC online. I know that's going to be a lot more complicated to do, but we're committed long term to thinking about how we can help be part of doing that. And so I think just being able to modernize and bring those food assistance programs online is something that we're really energized by, and we're excited to see such a focus. And then the other thing I'll mention is the focus on research in the space. We have been working to figure out how we can leverage our scale and our data insights to partner with research institutions to be able to bring more information to the fore here. One example I'll mention that we're hoping to do more of is we announced during the conference with the University of Kentucky and Share Our Strength, a new study that studied online grocery shopping benefits for SNAP recipients. And it actually found that it helps low-income families, including SNAP households, stretch their food budgets, save time and money, reduce stress and stigma, and adopt healthy shopping habits without increasing their budget. And so, we were encouraged to be able to bring our data there. We think there are so many more opportunities to use health data in collaboration with partners to be able to learn more about how we can increase the effectiveness of these programs. So those in particular really stood out to us.
Thank you so much, Casey. We're being asked, some people are hearing feedback, so I'm going to ask all panelists when you're not speaking, if you could mute yourself, maybe that will help. So I might have to remind you to unmute, and that's fine, no problem. I'm happy to do that. But let's go to Anwar with this question. Anwar, what was this like? Happy to see in the White House report and recommendation?
I mean, so much has been covered by my colleagues already. the main area that we were focusing on was pillar one, improving food access and affordability. But what we really appreciated is that there wasn't one pillar. There were 5 pillars. Everything is related to each other. So the integrated nutrition and health, the healthy choices, physical activity for all, enhancing nutrition and food security research, even though that's not really our main area. You know what I say? It takes a village. So to us, we're all part of that ecosystem. So for us, we were very encouraged by the food access affordability, especially expanding SNAP eligibility to additional underserved populations. We've seen this, and this is very important. We've been involved for years with the Alliance and other organizations to be doing advocacy for this, and we look forward to working on this as well. As was mentioned earlier, some people are trying to restrict what people can get through SNAP. We think that's the actual wrong approach. We should be expanding it. You can always look at in any policy that there's some people that you would argue take advantage of it, but then you have to look at all of the other people who have to suffer because of some of these exceptions that people bring up. So we think it's very important that SNAP has had a huge effect and helped to lift a lot of people out of poverty and out of hunger. That needs to be expanded. The other thing is making it easier for eligible individuals to access federal food, human services, and health assistance programs. Many people who are eligible for SNAP WIC are still not getting it because they're not aware. So we've already been earlier this week, as a follow-up to this summit, I spoke to USDA, some representatives of USDA, and I'll talk about this more later, about innovative ways of trying through our own network, our own faith community, of increasing people being able to have access and knowledge of SNAP programs. The other thing we thought was really interesting was in Pillar 1, was reducing barriers to food recovery. And this is very important for us. We've been trying to encourage people, and we've been talking to friends from different backgrounds of all faiths and no faith about how do we use our sermons to remind people that it's a sin to waste food. So this is on individuals, but how much food is wasted through the whole system, whether by government, whether by business, before it even gets on our plates. And the last one was improving access to emergency food, including during natural disasters. We actually work closely with FEMA. We just recently had 2 deployments. We couldn't choose between Puerto Rico and Florida, so we decided to do both at the same time, which isn't easy for a smaller organization. So we really are interested. Often when we go to these places, people are looking at rebuilding homes, they're rebuilding infrastructure, but people are hungry. And that food doesn't often get to them when they need it the most. So what we've been doing for several years, we give cash cards, several $100s, and we let people buy that food immediately. Now you may say, is that really a big deal? I remember talking to one of the survivors of Parkland. It was a couple who were just burying their 16-year-old daughter. And we had access to them through our emergency work through the FBI support center in Florida. And I asked, what difference? I'm so sorry, I'm only giving you $400. I wanted to give you more. What difference will this food make? Now, these were people who were going to get federal money to help to pay for the burial of their daughter and other things. They said, now we have money to buy food for the week. And sometimes we forget that. We can't wait for weeks to get food out. We need to get it immediately. So this is really, I just came back from Pakistan. There's 2 million people who do not have access to food out of the 33 million that were underwater in the last couple of months. We cannot allow this to be happening in America. It shouldn't happen anywhere in the world. But this is something that we were very encouraged because we're involved in food accessibility and we're involved in emergency work as well in the US. You're on mute. Minerva, you're on.
Thank you so much. Sorry about that. I forgot to unmute myself. Um, anyway, thank you so much, Anwar. And thank you, all of you. I think, at the Alliance, we can echo the fact that what's in the report is incredibly robust. The recommendations are really in line with many of the recommendations we've been making at the Alliance for years, and I would say really advances our agenda if we, as Dottie pointed out, if we can get some of these things codified into law, or the pieces that are able to move forward without legislation. This really does put us on a road to ending hunger by 2030. Having said that, and I think we can all acknowledge that this is a really important document that does achieve many of the goals of the anti-hunger community, if not most. Where are some of the gaps that we should be thinking about as we move forward in this work? Diane, I'll start with you if you want to share anything that you felt was missing, or was not included in the report that should have been.
Yeah, thank you, Minerva. This is it's such an essential question, and I'm going to be honest, as I always am, particularly in these spaces. I see similar gaps that I see when I step into many of these spaces, and I'm more talking about process here, and honestly, I'm not even necessarily talking about the White House. I'm really talking about all of us, and I want to say again, I am so grateful to those in this community who made engaging people with lived experience in this conference a top priority. Not only for yourselves, but obviously for the White House. Clearly, we were heard. We were in the room that day. But let me ask you all of this: is what was your expectation, and how did you share that with community, and how did you prepare them to engage in this conference, whether or not they were physically in the room? What was the plan for after the conference? Because if you didn't have one, then perhaps unintentionally you set folks up to feel exploited. Are you engaging and explaining what's happening now, how this plan will be implemented? As has come up, can you explain to community what the administration has the authority to do, and what it means in the strategy when it says that we will work with Congress, and how is that impacted by this month's elections? Are you hearing communities' frustrations and supplying them with the information and tools and resources that are necessary to really fully engage and to show up as a whole human being, and to participate? And are you prepared to stand up for community around the elements of the strategy with which we might disagree? So right now, I see an ongoing gap around planning and organizing from us, the anti-hunger community. And this doesn't negate for 1 second the hard work that we're all doing, whether it's feeding people every day, or if it's working on policy, or if it's working to establish the infrastructures to equitably engage people with lived experience. I'm just calling it out, and I'm going to say that if stating this offends anyone in the room, then I would suggest that it's time to reconsider your approach to this work. And just one more thing on the conference itself, and this was mentioned a bit before. But I would have liked to have seen more engagement from the agriculture community, because one thing that we need to understand is that when we're addressing food affordability, it's not the solution is not limited to expanding the SNAP program. And to be clear, I support increased SNAP access and benefit levels. But what I'm getting at here is the fact that there's an entire food fight that's going on in this country, of which many of us are entirely unaware, where there are certain special interest groups that are busy making a whole lot of money while advocating for regulations that actually make our food more expensive, with no consideration for the impact that has on people, and particularly SNAP recipients and those who have been so frustrated with the process that they're eligible for SNAP, but they're not applying, or, as noted earlier, those people who don't know that this program is for them. So, those manipulating our food costs, this is kind of akin to these efforts to force others to eat from their prescriptive diets. So in my view, this long view that I'm going to keep talking about, these practices, they're inherently racist, they're paternalistic, and they're culturally insensitive, as has been referenced here. So I think, in my opinion, to fill this gap, we as the anti-hunger community really need to take a serious look at how we're engaging folks in how we're sustaining that, and then take this longer view on what, in addition to the cost of inflation, has been making nutritious food less affordable and accessible. Thank you.
Thank you, Diane. Really appreciate that perspective, and always appreciate you for keeping our eyes looking forward in terms of the work that needs to be done. So thank you for that so much. Anwar, now to you. Are there any concerns or gaps that you all see in the report?
I think Diane spoke very forcefully. So agree with a lot of what she said. I just want to add to that, though. In Pillar 1, it mentions support food sovereignty, improve access to traditional foods, and ensure tribal communities are equitably served in federal programs. We completely agree with that. But we should also look at other communities as well. So whether, for example, one is vegan, vegetarian, kosher, halal, or whatever, there is some cultural sensitivity. We didn't hear that. And sometimes that you could say that's faith. Sometimes I would argue it's not faith. People prefer to be vegan. It may have nothing to do with religion. It's just the kind of lifestyle that they choose to have. So I didn't really hear much about that. And I didn't hear that much again about how faith organizations are involved at the conference. So I know I'm not saying you had to be there, but you asked me what did I think was missing. So I thought that there were some voices that were missing. There were so many voices that were there. So that was great. You can't put everything in. There were only 500 people at the event. There were so many points that needed to be made. But in answer to your question, I think that there were to do with cultural sensitivity, to do with faith, and some other groups maybe weren't added. But again, I want to concur with what Diane said earlier. And I think it's really important to also, what I thought was important was to hear more about why is it, and this isn't just here in America, it's also international. We are sending food aid overseas when it could be grown locally. Why? Who's making money out of that? How much money is, and how much money are people spending to lobby for their own interests? That I'm very aware of that internationally, and I think we need to see about that as well locally. But that would have been a really difficult conversation, I think, for some people to have. So that may be why they didn't have it. But I have the same concerns that Diane had here locally, also internationally. Are we sending the food in the right way? Is it really for the benefit of the person who's receiving it, or is it more for the benefit of strong interest groups?
Thank you, Anwar. Really important questions. Dottie, we'll turn this question over to you. What gaps do you see in the report?
So I will agree. I come at this from a policy angle, and I am the first to agree that there are all sorts of process and wider systems issues at play here. And I definitely think we need to talk about them. So I appreciate Diane and Anwar's remarks. To me, the biggest policy gap was around immigrants. I was really just shocked that there was no mention of in this country the role that immigration status plays in hunger and food insecurity, given many non-citizens are not eligible for many programs, given the need for action for the government to take action to reduce people's reluctance or improve people's willingness to participate in programs when they are eligible, because of the fear of what that will mean for their future immigration status. So that was quite shocking to me, actually. I was surprised to not see a more robust conversation in the document about the root causes of hunger and poverty, including racism, low wages, education issues, disability and other health issues, housing inequality. I think it's hard to figure out how to solve problems without a good definition of the problem. and a root cause analysis. I know that there were very quick timeframes here, but that seems to me something that is important to, to follow up on and to really center in terms of when you think about how to solve it from a policy angle. I have to say for my friends in the charitable sector that there was not a lot of talk about the role of emergency food assistance, which was surprising to me given that it is such an important part of the whole system, especially during disasters, but even for people, many people who aren't eligible or in between who are experiencing difficulties, that the program leaves where the sort of the general supports that we expect to be available for people have gaps or are not robust enough. And finally, I guess I would just say that the area of housing is such an important contributor here. The cost of housing, the huge gap in the available of assistance for everybody who would qualify for assistance is a big problem. And it was mentioned, but I think that it's something that could have been highlighted and had more specificity articulated towards it.
Thank you so much, Dottie. So much to think about. It's amazing how such a comprehensive document, as you said, still has some pretty significant gaps, and we know we have our work cut out for us going forward. So thinking about going forward, so this will be our last question to the panel, and then we'll open it up to audience questions. So please add your questions in the Q&A, folks, so we can get to those. Thinking about next steps. So what are your recommendations about moving this agenda forward, implementing some of these opportunities? Where do you see opportunities to move forward, and what would you recommend as next steps here? Casey, why don't we go to you first?
Thank you. I think we're certainly committed to this for the long run, and I think so a lot of the work that we're doing post conference is taking a look at the commitments that we have made and making sure that we have clear ways to measure them and to chart out progress. But I think it sort of breaks down into near-term potential possibility and long-term. We'll see what happens with the Farm Bill this year, but I think there's some opportunity perhaps in continuing to think about how to modernize the online payment processes for SNAP, for TANF and other, not in the Farm Bill, but for for TANF and other programs. We will be focusing on WIC. I think that's going to be a much longer horizon, but that's sort of some of the short-term focus that we have is working through, modernizing the programs to include more online access. The thing is thinking about where we can partner with third parties, nonprofit academic institutions to think about what research is needed. We're looking at the food as medicine space and thinking about what we might be able to bring there, as well as access and measuring progress of access on our platform. So, I would say for any of those who are interested in working with us or thinking about these things, instacart.com/health is our center for work in the anti-hunger food and nutrition space, and I think we're looking for opportunities to help contribute to the conversation.
Thank you so much, Casey. Why don't we turn the question over to Anwar? What do you see as next steps for yourself, at Islamic Relief USA, but also more broadly for the anti-hunger community to move some of these things forward?
Okay. One concrete step is earlier with USDA, and we were brainstorming. They said, how can we use faith organizations to get the message across and reach out to people in a credible way that they actually listen? Often we know that when the government and others say things, not everybody listens. Many people may listen to their faith houses, or they may listen to other ethnic cultural places. So an idea that I had and I discussed with him, it's just brainstorming, was that we look at their priorities and we help them. So we write the sermon, we get the sermon distributed to imams across America, and they're encouraging people to look into SNAP programs, look into other programs that they may not realize that they're eligible for. Many of them are immigrants, many of them are refugees, they've come from other countries, and they're suspicious of giving their information to government because bad things sometimes have happened to them overseas. So if they hear from local leaders that they trust, that may help. So that was just one example. And we were also looking at other ways that we can utilize with government, because it's not appropriate for government to do this, but we can take the message, the good messaging that they have, and use that through different sermons to try to get their point across of how to reduce hunger issues and anti-poverty. And as far as our general work is concerned, honestly, as I said, I would have liked if there was some more mention of faith at the event. But to be honest, I wasn't even sure that we would be invited and even be at that event. So I take a positive thing that I feel like I'm part of the community, and I want to engage with the community. And I think it was a wake-up call to us that we need to go and maybe come up with some commitments. We're already doing the work, but that will encourage others, and other people's commitments will encourage us. So I think that that is a sense of community, working together. And I share the concerns. I don't know what's going to happen with Congress, with the new Congress coming in. However, how can we, within our own community, work together and learn more from each other? So I thought that that was something interesting. It was a learning experience.
Thank you so much, Anwar. Why don't we go to Diane with this question? What would you like to see as next steps, and what are you all working on at Equitable Spaces as next steps?
Yeah. Thanks again, Minerva. Before moving anything in this strategy forward, we need to first put this strategy before community members with lived experience in a way that is more digestible than a 44-page report. Earlier this week, the White House hosted a debrief for those with lived experience and attendance at the conference. And it became immediately clear that despite the expressions of gratitude from so many for the opportunity to participate, just Anwar, as you were just referencing with the faith-based community, so grateful for the opportunity to participate and for further engagement. But the frustration and disappointment was palatable. People openly questioned if they had been exploited. Was this just another check the box exercise? And I had mentioned earlier the efforts that we had to put into pushing back against potential SNAP restrictions. Yet when I read the report, I still see the pathway there. And I think about, the idea of adding these stoplights on the front of package labeling on food deemed to be unhealthy. And then I think about, well, what are the unintended consequences here? What will the cost to companies be to upgrade their packaging? And who do we think is going to pay for that? We as consumers will. And, I'll add that never once in my, many years of being in and out of poverty, nor in the thousands of conversations that I've had over the years with people who've experienced hunger, never once has anyone ever said to me, you know what, Diane, I'm hungry. And I just need those folks in academia and the government dictating what I can and cannot eat, or maybe a stop sign will get me to eat healthier. No, people who know this struggle like I do, like my children do, talk about the lack of access to affordability and the lack of affordability of nutritious food. We talk about the stigmas that we face when, despite working our, full-time jobs, we can't afford to feed our children and pay the rent. Who are we to tell somebody living, this is something that T, who I mentioned earlier, who are we to tell somebody living in a food desert that the solution to their nutrition related chronic disease is to just eat healthier, while we fail to address in any meaningful way access and affordability. And, on the other hand, also unnecessarily increasing the cost of our food along the way. And, I will never dismiss the importance of nutrition education, but y'all, we know what's healthy and what's not. We just can't afford to access it. So I think what we really need is a gut check with community and asking those questions that the White House posed to us the other night. Do you see yourself in your community reflected in this strategy? And then what tools and resources do you need to fully engage? So I think those are some things that are rising to the top for us at Equitable Spaces, and hope that, again, thank you for this platform to share some of what's resonating for us. Thank you.
Thank you so much. Dottie, will go to you with that question. And it looks like we've addressed the questions that we've received so far. But Dottie, why don't you go ahead and answer the question? And folks, if you have any other questions, please add them. Thank you.
I'll be quick. I think, am I muted? Can you hear me? Okay,
yes.
Sorry. I was saying I'll be quick. I think momentum is the key here. FNS hosted, or USDA hosted, a follow-up on food as medicine a couple weeks ago. And I think we need to keep the momentum continuing in other areas as well, leading into the Farm Bill, which is expected to happen next year and beyond, and really keep reminding policymakers and the public about who the people are who experience hunger, right? I think there are many stereotypes that don't mesh with reality, let's put it that way. And also the fact that the investments that as a country we make a difference in people's lives. And it does not need to be partisan, right? This is not an issue that ought to be partisan. It's a faith issue, as has been mentioned. It's a human rights and dignity issue. And I think that there is a lot of agreement and very clear evidence. And so I was gonna, and then, the idea that the commitments that people have made, people need to be reminded of, including the government in that document, the things that they've already committed to do. So I think I'll just leave it there.
Minerva, you're on mute.
Yes, I managed to unmute myself. So there is a question about what organizations are doing right now to hold the White House accountable, and how. And I think for ourselves, at the Alliance, we're continuing the conversation, and part of what we're trying to do is also get a little bit more specificity in terms of some of the recommendations. It wasn't always clear, like, how were we going to achieve that? Is that through legislation? Is that through policy? So I know that we're going to continue just looking for that clarity and pushing forward whatever items we can through legislation or through regulatory changes. But does anyone else want to address this? How can organizations hold the White House accountable for the report that they've put out in the recommendations?
I'll just jump in to say and really reiterate something that I said, and I appreciate the question, Megan, is we need these constant check-ins with community. Over are the days when organizations are, on their own, not necessarily informed directly by people with lived experience. I think that, accountability really comes holding ourselves accountable as this anti-hunger community, and listening to and learning from community members like yourself, Megan, and then also making sure that we are creating the pathways and putting people with lived experience in proximity with the information that they need, and then also with the people in power who will ultimately make those decisions.